Brenda Novak's son Thad was only 5 when he began exhibiting the symptoms of type 1 diabetes. Since his diagnosis, Brenda has raised over $1 million to help search for a cure. Brenda joins us now along with Dr. David Bloomgarden, a diabetes specialist and board member for the American Diabetes Association Research Foundation. Brenda Novak, Dr. Bloomgarden, thanks to both of you so much for being here today. Brenda, I'm going to start with you. Tell us a little bit about your experience when Thad was 5 and he began exhibiting what symptoms?
Well, he actually had really frequent urination, a really strong thirst. We couldn't even drive 5 minutes from school to home without him begging me to stop. And what's usual is sometimes you'll get a virus or something that sort of jolts your immune system, and that's what happened to him. He had this virulent flu, and then immediately after, his symptoms came on really strong. So I was fortunate that they came on that strong and that I was able to recognize them quickly.
Right.
But that isn't always the case. Sometimes, you know, they will develop slower or go unnoticed for some time.
That's what I was going to ask you, Dr. Bloomgarden. Did the way the symptoms presented themselves in Thad, is that typical?
I think it's relatively typical. I think sometimes, though, it may not be as observed. Some parents are clearly more aware than others. Many times children will not disclose to the parents. I mean, clearly for Thad, who was 5, the parent is much more involved, but somebody who might be 12 or 20 may not have the wherewithal to be saying to somebody that this is different. One of the things that becomes apparent is when a child is getting up frequently in the middle of the night, which is very uncommon, and so the frequent thirst, the excessive urination is sometimes an early telltale sign that something's going on.
But type 1 diabetes can present itself at any age, or is there a typical age?
Well, we know it often as juvenile onset, but in point of fact, what it means is that the pancreas is not making insulin, and that can occur at the age of 2 weeks or 80 or 70. So it does occur throughout life, unfortunately, and I think sometimes people have a misunderstanding about that when they are having some of the symptoms. They're older, they make the assumption that they simply have what we call type 2 diabetes, when in point of fact, if the pancreas is not producing insulin, they simply have an older onset of type 1 diabetes.
Now, this can obviously be a very difficult diagnosis for a parent to receive. What were your emotions when you found out that Thad had type 1 diabetes?
Well, you know, you go through the natural grieving process, I think, that any parent goes through when they receive news that their child suffers from something that could be life-threatening.
It's life-threatening, but yet, Dr. Bloomgarden, you say it can be managed, correct?
It can be managed, and I think the one thing that I often try to preach and say to my patients, and when I have the opportunity with the American Diabetes Association, is simply greater awareness, greater knowledge makes a huge difference. And I think that, unfortunately, too many in the public still don't get it. We still hear the expression, I have a little sugar, or mom has a little sugar. It's not just a little sugar. And I think that having the greater ability to get that information across, one of the things that I certainly do personally as a physician, but in my work with the American Diabetes Association, it's enormously helpful when people begin to understand that there is something they can do to keep themselves healthy.
Absolutely. And how did Thad adjust to his new lifestyle? Was it a big adjustment for him?
It's a huge adjustment. They put him in the hospital for a couple of days. The first time they handed me a needle, I almost passed out because I was, you know, scared of needles at the time and thinking, I have to do this to my son how many times a day? Right. You know, learning to insert his pump when that time came along was daunting. At 5 years old, I was somewhat fortunate in that he was still pretty malleable. But, you know, if that diagnosis comes when somebody's a teenager, it can be very difficult because you've got self-image, things that are going on at that age. You know,
and now Thad is a teenager, correct?
Yes,
and is he still managing his condition well?
Yeah, he's doing well. I think what can be frustrating to a parent is you are told by doctors and caregivers that it's manageable. But there are times when it's not. And it's just the body does kind of crazy things and you're doing all you can and yet you still feel like you're not enough.
And that's frightening.
That is. It's very frightening, which is why I've chosen to give the money that I raise to the Diabetes Research Institute, which is a cure-focused foundation. That's exactly what they're going after, is trying to
It's wonderful what you've done. You've raised
this.
over $1 million so far. Your organization also raises money. How close are we to a cure?
I wish I could say we were close. I've been saying it for many years. I think that the public, again, has a hard time appreciating what's involved in terms of trying to fund projects. We were talking before about the potential impact of stem cell research. No guarantee, but certainly the possibility that if we can get farther with adapting cells that are mimicking or like the cells of the pancreas, then we may be able, in fact, to treat patients, cure patients. But I think that we've come miles. We need to get farther, faster,
right.
And that's what we are all about.
And where can people go to get more information and to help out?
I do my auction every year on my website at BrendaNovak.com.
BrendaNovak.com.
Right, where I can utilize the traffic I've already established there. I'm a New York Times bestselling author of romantic suspense. So that's really what gave me the idea. I already had this stream of traffic, and I wanted to see if they would help me raise money for my son and everybody else like that. So we run the auction every May 1st through May 31st at BrendaNovak.com.
Fantastic.
And there are so many ways people can get involved. They can donate items we can put up for auction. They can act as shoppers and buy their gifts there.
Great.
So yeah, it's really fun. It's a great community.
Also, people need more medical information if they're curious about the disease.
The American Diabetes Association has a website, which is diabetes.org, diabetes.org. Huge information. And one other thing, I will whip this out, which is a campaign, which is Stop Diabetes.
Wonderful.
And it's stopdiabetes.com. And individuals there can learn more about caring, giving, sharing, and getting involved with the American Diabetes Association, those funds for research, information, and advocacy.
Thank you so much, Dr. Bloomgarden. Brenda Novak, thank you so much for sharing your personal story with us.
You bet.
And for more health news, log on to abcnews.com.